Hi everyone, my name is Nancy Stone and I'll be talking about non-Hodgkin's B-cell lymphoma. So, what is cancer? In normal cell growth, cells grow, divide, and replace. In cancer cell growth, old cells continue to grow and form new abnormal cells. This rapid growth makes it harder for the body to function properly. There are many different types of cancers that include breast cancer, lung cancer, colon cancer, and blood cancer. Lymphoma refers to blood cancers that occur in the lymphatic system. Non-Hodgkin's lymphoma is a type of blood cancer. Tumors develop from white blood cells called lymphocytes. Non-Hodgkin's lymphoma can affect lymph nodes, the spleen, bone marrow, the thymus, adenoids and tonsils, and the digestive tract. Non-Hodgkin's lymphoma is actually very common, and it's been reported that 66,000 new cases occur each year. There are three types of non-Hodgkin's lymphoma: T cell, B cell, and NK cell. In T cell, the T lymphocytes kill foreign invaders directly. In B cell, B lymphocytes fight against infection by producing antibodies. Non-Hodgkin's B-cell lymphoma is actually the most common and is responsible for 85% of cases. There are three grades of non-Hodgkin's B-cell lymphoma: intermediate, low, and high. In intermediate grade, you have diffuse large cell lymphoma, primary mediastinal large cell lymphoma, anaplastic large cell lymphoma, and in low grade, you have marginal zone lymphoma, mucosa-associated lymphoid tissue lymphoma, follicular lymphoma, and mantle cell lymphoma. In high grade, there's Burkitt's lymphoma and lymphoblastic lymphoma. The image on the right shows what cancer cells look like in four different types of lymphoma. In A, we have Burkitt's lymphoma. B shows B diffuse large cell lymphoma. C is lymphoblastic lymphoma, and D is anaplastic lymphoma. Diffuse large cell lymphoma is the most common and accounts for 1 in 3 cases. Because not all lymphomas are the same, some can be more aggressive than others, it is important to distinguish between the different grades because it allows the treating doctor to utilize the most effective form of treatment. Some common symptoms of non-Hodgkin's B-cell lymphoma include swelling of the lymph nodes in the neck, the groin, and the underarm, night sweats or fever, unexplained weight loss, and lack of appetite. In more severe cases, patients have noted that they had difficulty breathing along with pain and fatigue. Many different types of testing can be done in order to determine which type of lymphoma has occurred. Image testing such as X-rays, CT scans, PET scans, MRIs, as well as biopsies and bone marrows can be done. Biopsies and bone marrows are the most common procedures, but if necessary, flow cytometry and immunohistochemical stains may also be used. There are many different types of treatment to combat non-Hodgkin's B-cell lymphoma. There's chemotherapy, radiation therapy, proton therapy, immunotherapy, stem cell transplantation, and radioimmunotherapy. Each treatment can be effective either on its own or it can be combined depending on the different types of lymphoma that occurs. As I mentioned earlier, different types of lymphoma require different types of treatment. Some types of lymphoma respond better to just one treatment, while others are more effective with a combination of treatments. For example, in follicular lymphoma, alkylating agents plus rituximab is used, whereas in diffuse large B-cell lymphoma, 6 different types of treatments are required. But in Burkitt lymphoma, only chemotherapy sessions are needed. Non-Hodgkin's B-cell lymphoma is a very treatable and often curable disease. With the growing medical technology, the outlook will only be better.